Robert, you moved to Boca Raton, and we're so happy to have you, a holistic doctor here. And what kind of a strategy you treat patients?
Thank you. Yeah, so I'm a board certified licensed family medicine doctor. I started a practice recently called Boca Direct MD. I like to try to take a very proactive, preventative approach, and use evidence-based, natural approaches, to medicine. So,
But if patients have problems, like they will join the membership, and how much per month?
So it depends on the age. So for patients 18 to 39, I'll charge $99 a month. 40 to 59, $149 a month, and then 60 and up, $199 a month.
That's very reasonable price. Yes, about 60, then the body changes.
And then patients can cancel anytime, and I use point of care ultrasound. I try to be as proactive, so I'll screen people's carotid arteries for disease. We could look at their kidneys to make sure they don't have cancer, which I think is very important, but a lot of people don't routinely do that type of test.
How about the arts? You said the other day you scanned my arteries and see if there is a blockage, right? And you're gonna combine that with a calcium score or cholesterol and analyze that?
Yeah, so depending on the age of the patient, if people are younger, then there are certain proteins that we can look for, like lipoprotein A or apolipoprotein B and A1 to assess their risk for heart disease in the future. For people who are a little bit older, I think a coronary calcium score can be helpful for ruling out any severe heart disease that they've accumulated over those many decades of life already.
How about if the calcium score is 2000, do you think the blockage of the carotid artery is very bad, or there's no correlation?
I don't know that there's necessarily a correlation, because
Okay.
I've seen different cases where there've been blockage here and no blockage around the heart. Potentially
you
even
could
the
have
opposite.
blockage here, but no blockage here.
Yeah, so I think it's important to look at both, because
Okay.
I've seen different cases where there's also cases where there's significant plaque formed in one artery around the heart, but not in any of the other arteries around the heart. So we don't necessarily understand why. Maybe there's some sort of inflammatory process in that particular artery for some reason, right? But those are.
But do you have cases that the calcium score is low, but there is a blockage?
Yes,
There
I have
is.
seen a case like that.
Okay, so you have to do both. But your ultrasound machine, can you do the heart or just the carotid artery?
So you can scan the heart just to assess the valves, the structure, and the function of the heart in terms of how much blood it's pumping out, but you can't actually see accurately the blood vessels supplying blood to the heart, which is where people get heart disease.
But can you see the coronary artery blocked?
Not really well with an
Okay.
ultrasound, just because
Okay.
it's so small. So that's typically where we use those calcium scores.
Okay. How about the blood test for predicting the Alzheimer's or Parkinson's or?
Sure, yeah. So there's the ApoE4 gene that we can test for that can be strongly associated with increased risk for Alzheimer's disease. So, I would offer those tests to certain patients, or testing to see, if someone has mutations that can increase their risk for certain types of cancer, as far as it can inform our management. So if someone knows that they're at a higher risk of, say, breast cancer or ovarian cancer, then they'd be more likely to do something about it, whether that's more testing or some type of procedure, depending on how risky it is.
Yes. And then if I become a member and I'm over 60, so it will be $199, right? And then how many times I can talk to you?
So unlimited visits,
Wonderful.
telehealth, just, we can message through the patient portal because it's secure.
Oh, wonderful. That's
no co-pays with visits, no enrollment fee.
Oh, that's wonderful.
No insurance required, but I think it's prudent for people to have insurance just in case an emergency happens and they need to end up in the hospital.
Yes. So for the consultation, I can just subscribe the membership, and then if I have problems, I can just call you.
Yes.
Wonderful.
Exactly. Or send me a message. And I'll provide a phone number that people can text that goes through the secure patient portal so that we can message back and forth.
How about you prescribe the blood work and medication? You can do that, right?
Yes,
Okay.
I prescribe blood work, labs,
Uh-huh.
imaging, referrals to specialists if you need, all through insurance. I just
That's
don't
the
bill
insurance covered, right?
Insurance can
Yeah.
cover that. I just don't want to bill insurance because it
Okay.
comes with other requirements, that I don't believe are necessarily in the best interest of the patient.
Yes, exactly. That way you have time to talk to patients. But say if I have some blood test and should I just subscribe to send the bill to the insurance, the blood test?
Yes, and I can get people a discounted rate on the blood test through, as part of a national group for direct primary care providers.
So we don't have to go to insurance, the blood test.
It's probably cheaper to do it without insurance, actually. It depends on which lab test you're talking about, but I believe it will be cheaper to get the lab work done without insurance.
Without insurance, okay.
Some
and
of
then
the time
an MRI or...
Well, that could depend the MRI. I mean, I've been able to get MRIs done for $300 cash with no insurance, And so it just depends on where you go because different companies charge different amounts for the same study, and what your insurance deductible or copay is.
Yes. Sometimes $1,000, $2,000 copay.
Yeah, which is crazy when you can just pay $300 out of pocket. So.
Yes, exactly.
Yeah.
And then they can get access to you if they have any questions.
Yes.
All right,
exactly.
thank you. I'm gonna subscribe and as a member, and I'll